Thank you, Dr. Evans. Good morning. It is my pleasure to join Chairman Sanders to talk about connected health and the innovations that it has provided us with in the veterans healthcare system. First of all, I want to recognize Dr. Tommy Sowers. Tommy, where are you? Good. Tommy is VA's Assistant Secretary for Public and Intergovernmental Affairs, and we're glad to have you join us, Tommy. Thank you. This is an exciting time in VA healthcare. We're moving to a delivery model that, with technologies, not only puts veterans in the center of their care, but empowers them to actually drive their care. We're going beyond simply treating problems and diseases. We're treating the whole person, and we're forming lifelong partnerships with patients that optimizes their health care and their well-being. As you're going to see today, these technologies are allowing us to offer patients more options for care and greater access to their providers than we've ever seen before. Patients tell us that they want better connectivity with their providers, and the better patients are connected to their providers, the better their health. When a veteran enrolls in VA today's healthcare system, she's likely to encounter many of the technologies as you're going to see today as she moves through our system. When she arrives at her local VA medical center for her first appointment, she may register at one of our kiosks. She may be introduced to My Healthy Vets and its personal health record, and she may learn through Blue Button that she can print, save, and share her personal health information and create a portable medical record for her own use. Perhaps our newly enrolled veteran will find out more about mobile health applications such as the PTSD Coach. A sample here on the iPad, and you're going to be able to look at this later on as you move through the displays. These mobile apps are rapidly changing how veterans access the resources and information that we have available to them. Through these apps, we can engage patients and caregivers outside of the traditional office visit. Veterans may learn that she can receive care through our telehealth program, or maybe her provider will use ScanEcho, a technology used to gather her team together to recommend a particular treatment plan. These technologies are helping us create a system of care without walls, a virtual system of care. We're delivering health care when and where veterans need it, not where it's convenient for us. And we're helping to lead the nation in developing efficient and robust virtual systems that benefit all Americans. In fact, last week, VA received a 2013 Most Wired Award. This award is given by Hospitals and Healthcare Networks magazine and recognizes health systems that are leveraging health information technology in new and innovative ways. While some of our individual medical centers have been recognized in the past, this is the first time that our entire system has been honored with this award. It's now my honor to introduce our next speaker, Senator Bernie Sanders, Chairman of the Senate Veterans Affairs Committee. Chairman Sanders was elected to the Senate from Vermont in 2006 after serving 16 years in the House of Representatives. He is the longest-serving independent member of Congress in American history. Before he was elected to Congress, Chairman Sanders served 4 terms as the mayor of Burlington, Vermont. He serves on 5 Senate committees: Budget, Veterans, Energy, Environment, and Health, Education, Labor, and Pensions. His priorities include universal health care, fair trade policies, and supporting veterans. America's veterans are indeed fortunate to have such a committed advocate in Congress working every day to ensure they're getting the quality health care they have earned and deserved. Please join me in giving a warm welcome to Senator Bernie Sanders.
Dr. Petzel, thank you. Dr. Evans, thank you. And let me thank all of your staffs for putting on this important event. And I want to take this opportunity to thank the hundreds of thousands of VA employees in the healthcare area who every single day are doing their best for our veterans. I come from Vermont. Our hospital's in White River Junction. And I can tell you that when I speak to veterans around the state and ask them about the quality of the health care that they're getting, they're proud of it and they're very appreciative of the hard work that the staffs in Vermont and around this country are doing. Since becoming chairman of the Senate Veterans Affairs Committee, I have come to realize that the American people do not know a whole lot about VA health care, and they should, because VA health care is providing health care to some 8 million Americans, people who have put their lives on the line to defend our country. And I think it's important that the story what VA healthcare is about is in fact told to the American people. And frankly, I hope that we will see more events like this in the future, because the VA has a very interesting and very important story to tell regarding the excellent and often cutting-edge work that they are doing in healthcare. And I think that's a story the American people don't know, and they should know. They're paying for it. Most Americans do not know that the VA is the largest integrated healthcare system in the country, with more than 8 million veterans currently enrolled. They don't know that VA care is provided in 152 medical centers around the country, and that VA has an enormously strong commitment to primary care through some 900 community-based outreach clinics, 300 vet centers, and 70 mobile vet centers. And as chairman of the subcommittee on primary health care in the Health Committee, I can tell you that we are not going to get health care right in this country unless we transform our primary health care system, make it much more aggressive than it is today, and VA is helping to lead the country in that direction. As I've toured VA medical facilities around the country, I've seen firsthand how VA is leading the way in a number of very important areas, including the prevention of hospital-based infections, serious problem nationally, prosthetics development. Some of the work that they and the DoD are doing is absolutely unbelievable. The offering of integrated health care services, which are rapidly bringing so-called alternative health care and complementary medicine into the mainstream. This is a big deal. They are also developing, as we know, given the tragedies that we have seen in Iraq and Afghanistan, and the large numbers of our people coming home with PTSD and TBI, VA is at cutting edge in working on those serious issues. Today, we're looking at another area where VA, in my view, is doing cutting-edge work, which the rest of the medical community around the country, I think, is going to learn from. And that is that they are taking advantage of modern technology in a very aggressive way to provide high-quality and cost-effective health care to their patients. This is an extremely important breakthrough, as Dr. Petzel has just described, because it significantly improves access to health care. It brings health care, in many cases, right to the home of a patient. This is important nationally. It is especially important in rural America, in states like Vermont, where our patients live a long distance away from a medical center. So the idea that you can be at home and now have contact with high-quality medical providers is an extraordinary breakthrough, and I thank the VA for doing the work they're doing in that area. Innovations in technologies like home telehealth allows the veteran to work with their provider from home, reducing the veteran's need to travel while still allowing clinicians to track important health information such as blood pressure, weight, and insulin levels. In Vermont, I was told that on a daily basis, our doctors and nurses are keeping in touch with patients, and that human contact that otherwise could not take place without technology is a significant step forward. Additionally, VA's mobile applications, like the PTSD Coach, gives veterans access to care right at their fingertips 24 hours a day, 7 days a week. Over 1,000 caregivers enrolled in VA's caregiver program now have an iPad filled with similar tools and tips, et cetera, et cetera. So what we are seeing today is some of the very good, in some cases, cutting-edge work done by the VA. I think as Americans, as taxpayers, we should be proud of that work. We're going to see that work integrated into healthcare in this country in general. So let me just close by thanking Dr. Petzel, Dr. Evans, and everybody else for making this event possible. Thank you.